block account for almost, if I see 100 cases of infertility, almost 25 cases will have some tubal issue. Countries like India, which are developing, so the most common cause is infections. They don't have any symptoms, or when they don't feel like, they don't have fever, they don't have cough, they just neglect the tuberculosis. But generally, one family member, if they have tuberculosis, obviously there will be some form of transmission. Spreads retrospectively, from the vagina or the cervix. The infection spreads to the tubes, which blocks the tubes as well. Spreads retrospectively.
Let me introduce myself before we start. My name is N. Jamir, and I work for Subhak Health Tech. So as you might be aware, currently we have two products in the market. One is the underwash machine, and the other is the home insemination kit called V-Conceive. The sperm washing machine is the underwash by Subhak.
Yeah.
So that's us. And we've had great feedbacks from gynecologists and from our patients also about positive pregnancies. So beyond that, what we're trying to do is talk about infertility, what it is, and we want to bring awareness about different topics. So we are asking doctors such as yourself to come online and share about specific topics with us so that we can give that education to our audience also. So that is where we are at. For our viewers' benefit, could you kindly introduce yourself?
Yeah. So, good afternoon, everyone. I'm Dr. Dheeraj, fertility specialist and laparoscopic surgeon from Kutumb IVF and Fertility Center, Visakhapatnam and Parvatipuram, Andhra Pradesh. So, I'm practicing since last 3 years. Our special focus is into infertility, IVF, fetal medicine, and laparoscopy. So, we have started our center in Visakhapatnam from the last 1 year. And we have been doing various research works and all in the field of infertility. And basically, we have a team of doctors. So basically, I'm an IVF specialist and laparoscopic surgeon. My wife, Dr. Rani Roja, is a fetal medicine specialist. So she's also gynecologist specialized in fetal medicine, and my mother is an obstetrician, and my brother basically takes care of male infertility. He's an andrologist at our center. It's all our family. It's like one-stop center. Like you come and you get a positive result and you just leave our center. So that's how we have planned each and everything.
What is the name of the center again?
It's Kutum. So basically in Sanskrit, Kutumbam or Kutum is family.
Okay.
So,
Dr. Dheeraj, since you are a laparoscopic surgeon, this topic falls right in your alley. And today we want to discuss about damaged or blocked fallopian tube, what it is, and help us understand how to go about it, whether there are symptoms or not, different types of treatment.
So basically, I am here to talk about the tubal problems and tubal blockages in females. So which is one of the major factor contributing to infertility nowadays. So basically, I'll be just giving a small insight into the function of the tubes and how do they behave and what is their main function in the female reproductive system. So basically, this is how the female reproductive system will be. All the females will generally have a womb. We call it as uterus, which bears the baby. So basically, the baby will be growing in this womb. This is called the uterus. Then you have these whitish structures are nothing but the ovaries or the egg producing organ. So this is the structure where the egg will be produced in the female. Like how males will have the sperms, the egg will be produced from the ovaries. Above this is this slender structures you see on both the sides, right and left. These are slender structures. So they are basically the fallopian tubes. What happens is, so egg will be released from this ovary, be carried away by the fallopian tubes, and it comes to the uterus. So basically, what happens? The egg should releases from the ovary. It should travel through the fallopian tube. In the fallopian tube itself, the fertilization also will happen. Fertilization in the sense, the sperm enters the uterus through the vagina, goes to the cervix, it goes to the uterus, and in the fallopian tube, the fertilization will happen. And in the early stages, of the embryo, not the baby, like the embryo forms in the fallopian tube, it comes to the uterus, gets implanted here, and 9 months it grows into a baby and comes out. This is the basic understanding of the tube. So basically what happens is, if you have a tubal problem like block or something else, So what happens? Your tube will be non-functional, or your tube will be blocked. So what happens? The egg won't be able to reach the sperm. So sperm gets blocked somewhere here, egg gets blocked somewhere here. So the fertilization won't be happening. So it does not result in the baby as well. So basically the reason behind me choosing this topic is, so generally tubal blocks account for almost, if I see 100 cases of infertility, almost 25 cases will have some tubal issues. I mean to say, this even tubal factor is much more prevalent in secondary infertility. What I mean to say, so basically the couple will be having a child, and after 2 years or 3 years they plan to have a second child, but then the difficulty arises. It's called a secondary infertility. In secondary infertility, approximately it accounts to almost 40%. I mean, 100 patients come with this problem, 40 patients will be having this. The incidence of this tubal factor infertility or tubal blocks or tubal problems is on increasing, is on the rise. So generally when a couple comes to me, or they say we are unable to conceive, and how should we proceed and all, almost every time, if there is almost 2 years of infertility or they are unable to conceive or some issues, anytime you need to order for a tubal test. Looking into the background of these tubal diseases, so patients keep asking us what is the cause? I mean, previously I was fine, or I have a child now, why I'm not conceiving? My tubes were good that time, now why are they getting blocked? So basically when we look into the background of the causes of the so basically in India, like countries like India which are developing, so the most common cause is infection. In countries like India, you have tuberculosis, which is prevalent even now. So tuberculosis generally is the most common cause in Indians or Asians. And when you go to the Western countries, there they have high rise of this chlamydial or bacterial infections, which cause these tubal blocks. So basically, where the patients miss the catch is, so in their childhood, they might have been affected by tuberculosis, or someone in the family might have been affected with tuberculosis. So what happens is they don't get tested, or when they don't have any symptoms, or when they don't feel like, they don't have fever, they don't have cough, they just neglect the tuberculosis. But generally, one family member, if they have tuberculosis, obviously there will be some form of transmission. So generally, generally the patients miss. I mean, even when I take the history, are you affected with TB and all? So generally they don't open up, or they are unaware of it. So TB is one of the major cause which should be ruled out. Then comes your tubal surgeries. So what happens is sometimes the patients might have the pregnancies in their tubes, fallopian tubes, call it as ectopic pregnancy. The pregnancy, instead of coming in the uterus or the womb, it gets implanted in the tube. So generally what happens is, if you diagnose little early the pregnancies in the tubes, we try to deal it medically by giving some drugs like methotrexate or something. But if it gets delayed, the tubes might get ruptured, there will be torrential hemorrhage, and we may need to remove the tube. So tubal surgeries is also one of the cause for this tubal blockages. Then your other infections like white discharge, which is little smelling and all. So generally women, who are living in little rural areas, urban people, generally they immediately react whenever, because I practice in rural as well. We have one of our center in the rural area. So generally there the women, even if they have white discharge or some form of foul smelling discharge, they delay. They don't reach to the doctor immediately. They take their own medications or some other medications, they just neglect it. So what happens, this infection spreads retrospectively, from the vagina or the cervix. The infection spreads to the tubes, which blocks the tubes as well. So that is one of the cause. And one more reason which I have observed in recent days, when the women go for medical termination of pregnancy like MTP and all. So generally what happens, they do it incompletely, or they don't take antibiotic tablets post post termination of the pregnancy. So this itself results in infection. So yeah, so even MTPs, we generally advise to go to the gynecologist or whoever is trained in it, not the regular MBBS doctors or RMP doctors. So generally, when you don't follow the protocol, it results in some form of secondary infection, and after 1 or 2 years, when you're trying for a child, then the cause comes. So always, so basically, tubal block or tubal problem, patient don't come to us saying, I have a tubal block, do something. Patient come to us with infertility, or patient come to us saying we are unable to get a child. Then we do the test, and then you diagnose the tubal block. Then retrospectively, when you go into the detailed history of the patient, then you identify the cause, like something like TB or infections or some tubal surgery or something. That's the reason even the diagnosis gets delayed. I mean, you don't have any symptom in specific saying this is gold standard for tubal block. So it's always a retrospective diagnosis.
You said the first, for couples who are not able to get pregnant the first time around, tubal cloggages or damage constitutes around 25%. And for secondary infertility, we see a sharp rise in the number, and it's
40%.
Yeah. Why do you think that is?
Yeah, so coming to the rise in the secondary infertility tubal block, so basically that's the reason. Women, they just delay any form of little white discharge, infections, or any, generally they do 1 or 2 abortions in between if they are unable to, they are unprepared for the pregnancy, and that abortions are not dealt properly. All these actually, they contribute to this infection, and finally they cause this tubal block.
When we say infection, I know yeast infection among women are very rampant.
Yes.
Is that also a cause?
Yeah. Yeast infection as such, it does not contribute much percentage. There is very little incidence of yeast infection causing this tubal block. As such, even the research papers, everything, they say in Indians, the most common cause is tuberculosis, followed by your chlamydial or bacterial infection. Yeast could be one of the cause, which should not be, just left out. But as such, it may not contribute much to your tubal block.
Dr. Dheeraj, so for something like a blocked tube, you said there are no symptoms. That's what makes it more scary.
Because people don't have any complaint saying this is my complaint, so please treat me with this.
Yeah.
Basically, couple come to you, you test, do some tests, and then it comes to you.
Not even a slightest pain or discomfort, nothing?
So generally, we infertility specialists or gynecologists should be more vigilant. Like if they, when you go retrospectively take the history, then we come to know, she is having white discharge from 2 months or last 6 months, which she has neglected, or something related to TB, which she could not recognize it early. All these could be reasons.